I'm Chris. I'm an ophthalmologist in the UK. I'm going to talk about using computer vision for the automated assessment of the eyelids. Oculoplastics is a surgical specialty that's concerned with those vital structures around the eyes, which of course includes the eyelids. Some of the common conditions that I come across can include droopy eyelid or ptosis, thyroid eye disease, which is an inflammatory disease of the eye socket that causes the eyes to bulge forward, and facial nerve palsy, sometimes called a Bell's palsy. So in this chap, you can see that his right hand side muscles are not working properly, right brow's droopy, the right side of his mouth's not moving, and most importantly, his right eye does not blink as effectively as the left eye. Currently, we perform manual measurements to help us quantify eyelid position. That's either to assess disease progression or to measure the success of surgery. But more and more people want to be able to measure their own health status, and more clinical consultations are being performed virtually by video. So my question is, can we get any useful data automatically from those video images? My solution was coded using Python 3 in the OpenCV library. It uses a UNet convolutional neural network that's been trained on 7,000 or so images from a publicly available data set. The targeted output is upper and lower eyelid height. These are two fundamental measures that we use in everyday clinical practice. And here it is in action, detecting eyelid position and pumping out those figures in real time, frame by frame. We can also measure what we call blink lag ophthalmos. That's the amount that the eyelid is left open during a normal blink cycle. And it's hugely relevant, particularly in facial nerve palsy, but almost impossible to measure accurately in clinic manually. In this pilot study, I first curated a data set of consumer-grade online videos. Those are patients with facial nerve palsy, ptosis or a droopy upper eyelid, and thyroid eye disease, and then a bunch of controls to compare these patients with. And as a test of validity, I wanted to see if the program behaved as expected when comparing these different population groups. So in these slides, the grey distribution represents controls, and compared with those controls, the upper eyelid height is greater in those patients with Bell's palsy, but less in ptosis or a droopy upper eyelid, as would be expected. Compared with controls, the lower eyelid sits lower in thyroid eye disease, as is expected clinically. And blink lag ophthalmos, that's significantly greater than controls in both Bell's palsy and thyroid eye disease. So moving on from those population level comparisons, we can also start to appreciate the natural course of the disease if we look at multiple time points in the same individual. So for instance, Bell's palsy tends to come on dramatically compared with baseline. And while it often slowly recovers, it can often leave some subtle residual impairment that has always been difficult to quantify. And with this system, we can start to appreciate those differences in recovery. Comparing automated measures with manual measures in clinic, 95% of the time, these were within about a millimeter of each other. And this is almost identical to the agreement that one sees between two different clinicians that take these measurements in clinic. So I've been encouraged to see that it is possible to take clinically useful measures automatically from consumer-grade videos, so e.g. a webcam or a smartphone, with promising early tests of validity and reliability. Thank you very much.